This video will go over diabetes medication adherence pharmacy measure. The population that falls within this category of pharmacy measure diabetes medication adherence are percentage of patients 18 years of age and older that are Medicare Part D patients with a prescription for diabetes who fill their prescription often enough to cover 80% or more of the time they're supposed to be taking the medication. The numerator for this measure are patients who filled their prescription often enough to cover 80% or more of the time they are supposed to be taking their medication. Patients qualify for the measure on the second medication fill date, but the measurement period begins with the date of the first dispense. Some of the exclusions are first, received hospice care during the measurement year, second, have end-stage renal disease, and lastly, have a prescription for insulin. This is the list of medications that are included within this pharmacy measure. Some of them are biguanides, sulfonylureas, and the remainder that's listed on this slide. Some best practices to address this pharmacy measure are to always make sure write a 100-day or 90-day supply of maintenance medications and have your patients use a mail order pharmacy. Provide short and clear instructions for all prescriptions. Write prescriptions with refills for patients who are stable on their medications to reduce the risk of any time lapse between fills. Schedule a follow-up visit within 30 days of prescribing a new medication to assess how the medication is working for the patient. Schedule this visit while your patient is still in the office. Emphasize the benefits of taking the medication and the risks of not taking their medications. At each visit, ask your patients about their medication habits, including average number of doses they miss each week. Continue with open-ended questions to identify barriers to taking medications. For example, what side effects do you believe you've had from the start of this medication, if any? Do you ever forget to take your medications? What things have made it difficult to pay for your medications? What issues prevent you from refilling your prescriptions? In order to increase your performance, always work with your CPC to educate your team, build workflows to chart prep and identify open gaps before a patient comes in for an appointment, and always know the resources that are available to you at Arizona Care Network. First and foremost, your CPC and the education and support they provide to you. Quality measure tip sheets that are available on our Arizona Care Network website, Arizona Care Network provider portal, and lastly, Arizona Care Network Care Coordination Team. Please visit the Arizona Care Network website for updated 2024 tip sheets. The picture you see on this slide is the picture of the diabetes medication adherence tip sheet, and you can find this tip sheet on our Arizona Care Network website.